So hi friends, today we'll discuss the previous year question, part 3. Okay, so here the first question is, the 7-sheath flagella is seen in. So the option given are Vibrio cholerae, H. pylori, Pseudomonas aeruginosa and spirochetes. So here, whenever they asked for 7-sheath flagella, the only organism which is having is H. pylori. Okay, so the answer here is Helicobacter. So Helicobacter pylori. So here, that's the first point. It will be having about 5 to 7 sheath polar flagellum, whereas again that is in Vibrio cholerae and the Pseudomonas, they will be having a single polar flagellum. Okay, so coming for spirochetes, it is in spirochetes, it will be having an endoflagellum. Okay, so just remember here this among the option, so Vibrio and Pseudomonas will be having a single polar flagellum and H. pylori will be having 7-sheath flagellum, and as you know spirochetes, it will be having an endoflagellum. Okay, so these are the explanations. Okay, so second question is, so true statement about H. influenza. So first, it is grown on the sheep blood agar with carbon dioxide and it is not capsulated. Invasive strain is most common and it is in gram positive. Which is a true statement here is, okay, we'll rule out one. We rule out all the options. So first, it grows on sheep blood agar and carbon dioxide. No, it will be, the growth is usually seen in the chocolate agar. Okay, so first point excluded. So second, it is a non-capsulated. H. influenza, it is an encapsulated organism. So because of that, it is very responsible. So most commonly organism for causing the meningitis. So second option excluded. So coming for invasive strain is most common. Yes. So the invasive strains, it is in most common for causing a disease than the non-invasive strain. So coming for fourth option, so it is in gram negative and it is encapsulated. Okay, so here the option here is invasive strain is most common. So next, so third question is, so meningitis with rash is seen in. You can close your eyes and you can mark it as Neisseria meningitis. Okay, so whenever there is a meningitis with rashes, that too it will be causing a non-blanching rash, that is a petechial or the purpuric rash. So it is most commonly seen about 80% of the cases. So here the another point you want to remember in Neisseria meningitis is, so Waterhouse-Friderichsen syndrome. It is nothing but it is an adrenal hemorrhage. Okay, and it is characterized by DIC and rashes, etc. So whenever you are asking for Neisseria meningitis, you must remember Waterhouse-Friderichsen syndrome. Next, so which of the following it is a mechanism of action of tetanoplasmin? So here, so first it is an inhibition of release of GABA and glycine, inhibition of ACH release from synapse, inhibition of protein synthesis and activation of the adenine cyclase. So okay, so whenever they are asking for tetanus or related to tetanus plasmin, so it is mainly because of the inhibition of release of GABA and the glycine. Okay, so let us see the mechanism of action. So how it inhibits and how it causes the symptoms. So see, this you can remember this tetanus plasmin like So always remember the tetanus plasmin, right? So tetanus plasmin, there is OS. In tetanus plasmin there is an OS. So it is an oxygen stable. Whereas tetanolysine, it is an oxygen labile. Okay, so you can remember like this. So both tetanus plasmin and tetanolysine both are heat labile. So there is no confusion for that. So for tetanus plasmin, it is an oxygen stable. Okay, fine. So what happens here is, this toxin usually acts presynaptically. So just remember the toxin will be acting presynaptically, thereby it prevents the release of the GABA and the glycine. Okay, so that leads to spastic muscle contraction. So you want to remember, if this tetanospasmin, it is acting presynaptically, there is some other poison which is acting the postsynaptically, that is in strychnine poison. So just for completion sake, I am saying the strychnine poisoning, however they won't ask in microbiology, but it is an important in forensic medicine. Okay, so presynaptic is so tetanospasmin, whereas postsynaptic it is in, what is that? Strychnine poisoning. And so there is another term here. See, there is a second, the third point, inhibition of release of ACH released from the synapse. So yes, it is a Clostridium related to Clostridium botulinum. Okay. So just for completion sake, I am saying here the answer is A only. That is an inhibition of the GABA and the glycine. That's all. Okay. So next question is, so tabes dorsalis is seen in, so primary syphilis, secondary syphilis, tertiary syphilis and latent syphilis. So here, so tabes dorsalis, it is usually related to tertiary syphilis, that too more specific for neurosyphilis. But here they didn't give the term neurosyphilis, so you can go for tertiary syphilis. Okay. So T for T, just remember tabes dorsalis T and tertiary syphilis. So how you can, I want to remember some of the points over here. So first it is an, so late or the tertiary syphilis, and first it usually causes in gamma, that is usually present in about only 15% people, and this is a main important point. So cardiovascular syphilis, it is characterized by aneurysm of ascending aorta and the aortic regurgitation. Okay, so this can be asked separately as an MCQ. So you want to remember this point, aneurysm of ascending aorta and the aortic regurgitation. So next point is, so we come for the neurosyphilis. Okay, so this neurosyphilis usually comes under the tertiary syphilis. Suppose if the tabes dorsalis is seen in, so if they have given the option neurosyphilis or the quaternary syphilis, then you can go for that. So here the invasion of CNS usually occurs in the the first week of the infection. So, but it usually develop only in the late stage. Okay, that is usually tertiary syphilis is the third stage, right? So this neurosyphilis, it will also occur in the late stage, and so here the CNS and CVS lesions are called together as a quaternary syphilis. So this point, each and every point is important over here. Okay, so I'm not taking something which is irrelevant. So these are all points which can be asked in MCQs. So GPI, that is dental paralysis of insane, and tabes dorsalis, that is a demyelination of the posterior column of the spinal cord, and meningeal syphilis and meningovascular syphilis, that is because of vasculitis that can lead to the embolic stroke. Okay, so just remember tertiary syphilis, it is seen in the tabes dorsalis, it is seen in the tertiary syphilis. If they have been more accurate with neurosyphilis, the option have been given, you can go for neurosyphilis. Okay, so thank you friends.